Hello you guys, it's Dr. Vidal here at Pure Plastic Surgery. We are back with Tuesday Tips. We meet every week to discuss different topics in plastic surgery and more importantly, answer your questions. Today we're going to talk about scars. This is a topic that is it's broad and it's good for any surgery, any procedure, and the goal is to describe the different type of scars and what are the things that we can do to prevent ugly scarring or thick scars, and what are the treatment options once we have hypertrophic scar or keloid scars. So we'll talk a little bit about the different types of scars and then the treatments, and then we'll go up to your questions. Scars, if I can do surgery without scars, would be the ideal world, but unfortunately that's not our reality. We do surgery, and in order to access the different body areas and different skin accesses and every single area that we need, we're putting scars in the body. It's impossible to erase scars. So that is a very common question that I get. What can I do to make my scars disappear? Unfortunately, that's impossible. Scars form in our body as the body heals, and it's a mark that our body left there because it's something that it repaired, right? So the skin broke for different reasons, either trauma, either surgery, and the body heals it, and that's the scar or the mark that it leaves behind. Scars are our body's response to healing, but also they're never going to be 100% what the skin and what the area was before it was traumatized, right? So when the body heals, it goes to 80% its strength and capacity that it had before. So the goal with the treatment options that we have is to try to get that scar to heal the best possible way. So what do we want? We want the scar to be thin, we want the scar to be flat, and we want the scar to be a similar color as your skin. So those are the three things that are going to make a scar look good. So what are the three things that make the scar look ugly? So a thick scar, a dark or pigmented scar, and then a raised scar, okay? So the things that we're gonna do are trying to prevent those three things, okay? What happens when we get a scar that gets thick, dark, raised? Well, there are two things that can be happening. One, which is the most common actually, is hypertrophic scar. So the scar gets thick, raised, dark, but it's not to the extent that it goes away from the original incision. And that is a hypertrophic scar. A lot of people call them keloids, but keloid is actually more rare, and keloid is when it goes away or expands more than its original incision. So I'll show you some pictures so you can see. This one here, it's a good example because we have both components. This was originally a line scar. Here you see that the scar, it's still a line, but it's thicker and it's darker. So this is a hypertrophic scar. But then you have one end of the incision that got very thick and it got away. So it's now thicker than the original line. It went away or past that width of the original scar. So this is a keloid, okay? Here, for example, this is a very dramatic example of a keloid. This was also a line, and you can see how this scar grew out of proportions away from that original line, and that is a keloid scar. Here we have other options. This here, so we talked about thickness and we talked about width. Sometimes the scar gets wider but not thicker, and that usually is because of tension, stretching of the scar. And this is a widened scar, okay? It's soft, it's flat, but so this is a result of tension in the scar, okay? And this keloid and widen. Other two options. There's some people, especially lighter tone people, that tend to get the scars red. So that's called hyperemic. Instead of hypertrophic, this is hyperemic. Basically, it's red. Usually when you see this, you're still healing. So usually when you're still in the red part of the healing process, usually those scars tend to get better when they mature. When do we say that a scar is mature? It's up to a year later, okay? So trying to do things in that year, it's gonna improve the scar, and you're still in time. Even though your surgery was 8 months ago, if you're still within your year of surgery, you still can do things to improve that scar, and that scar is still changing. After a year, then the chances that that scar is gonna change with things that we do, right? We'll talk a little bit about what things we can do, is less. So the best thing to do is trying to do all those preventive and treatment options in the first year to try to get the scar to heal better, okay? Unfortunately not disappear, but as unnoticeable as possible, okay? So why the difference between hypertrophic and keloid? Keloid is harder to treat. Why? Because keloid is, like we talked, when it goes away or past the original scar, and it tends to behave like a tumor. It's not cancer, it's not like a malignancy, but it tends to behave that way. How the tumors behave, they grow and grow, and they don't have a limit. So that is what happens with keloids, okay? So that is why keloid is, the treatment options for keloid are harder, because they tend to come back, okay? So what are the options for keloid? One is excising it, right? We can go ahead and excise this and close it again. But why those keloids happen is usually genetic. It's usually your body's way of healing. There's some things we can do surgically to try to decrease the chances of keloid formation, like the tension in the incision. And in the early post-op period, things that I'm going to tell you to decrease the tension on the incision to try to decrease the formation. But really, at the end of the day, it's your body's way of healing. So keloid, if you just excise it and close it, there's a very high recurrence rate, up to 60%. So that's very high. If I take 10 people with keloids and I excise it and close it, in those 10, 6 of them are going to have keloids again in those scars. So 60% is a very high recurrence rate, okay? What are the other combinations that we can do? We can excise it and either inject steroids. So these are the, oops guys, whoopsie, here. So the treatment options, okay? The second one here, steroid injections, is one of the things that we can combine with the excision of the scar. So steroid, it's a medication that it's used for many, many things, but bottom line, it suppresses your immune system. That's what steroids do in wound healing. So when we inject steroids, we're suppressing the wound healing process. We're telling your body, I want you to heal, but controlled, okay? Don't go crazy and continue to grow healing product, and we end up with a hypertrophic or keloid scar. So this is one of the options. The thing with steroids is it's not as potent, okay? What do I mean by that? It's not that it's gonna, so we talked about 60% with just excising it. Adding steroids is gonna decrease it to 40 to 50%, okay? It's gonna help. So instead of having 6 people of the 10 with keloids, now we have 4 to 5 of the 10 developing keloids afterwards, okay? The third option, which is the more aggressive, and I usually reserve it for recurrent keloids. So we tried the excising it and closing it, and the keloid came back. So your option is adding radiation. Radiation is a treatment that we use for cancer. Like I said, keloids behave like tumors. So we need to treat it like a tumor. Even though it's not malignant, it's not cancer, it just behaves like it. So what does radiation do? Radiation attacks the cells. So basically, it's the same concept as the steroid, telling your scar, relax, don't go crazy, don't start making a lot of cells, just control it and minimal amount of cells, but a very severe message, okay? The radiation is very strong. So radiation should be given at least within 24 hours of your surgical excision. So we do your excision of the keloid. You need to have the first treatment with radiation within the first 24 hours, okay? So either the same day or the next day, you start the radiation, and it's usually for a week. You receive radiation to the area for a week, and then we decrease the risk of keloid recurrence to 30%. So of the 10 people, only 3. So it's never 0, and unfortunately, it's hard to treat, but in severe cases, when it's large, when it's recurrent, radiation is one of the things that it's more helpful. What are the things that I tell all my patients, right? So one of the common questions I get is, okay, so I'm getting a tummy tuck, I'm getting a breast lift, I want the scars to heal as nicely as possible. So what are the things we're gonna do? So number 1 is we talked about tension. So tension on the scars tends to widen, and when it widens, it's basically you're sending a message to the scar that with tension, you're trying to separate that scar, and the body is trying to heal it. So what is the body's response to the healing? Send more cells there. We have to heal that faster and thicker because they're trying to separate us, and they don't want you to separate them. So the response is actually making more scar, okay? So that's just the way that the body heals. So we want to avoid tension in the scars. That is very important, especially in the early post-op period. So for a breast lift procedure, what I'm gonna tell you to do? T-Rex arms. So tell my patients to keep your elbows close to your body. If you separate your arms or go like this, that's gonna put tension on the closures of the breast. So for the first 2 weeks, T-Rex arms, okay? For the tummy tuck, bent over, okay? Trying to protect and avoid scar. For the arm lift, same thing, T-Rex arms, trying to avoid tension. That's gonna be extremely important. At 2 weeks post-op, then we're gonna start scar treatment. What is scar treatment? It's basically a product that we're gonna apply to the scar to try to get the scar to heal with the 3 things that we wanted, right? Soft, not raised, and the color similar to our skin color. So what is the only medication that has been FDA approved to work or to improve scarring in the body is silicone-based products, okay? So you'll see there are a lot of products out there, including vitamin E, bio oils, different type of vitamins, different type of supplements, but the only thing that has been approved and studied and has good results is silicone tape. So that's the one I recommend. I recommend you starting on a silicone-based scar treatment 2 weeks post-op, okay? Which one do I recommend? The one that we sell here is Silogen. The reason for it is because it's the only product that is 100% silicone. So it's pure silicone that you're applying to the scars, okay? The silicone-based products come in 2 forms. One is a gel and the other one is a tape. Both work same, equally. They're comparable results. The only difference is what you prefer, okay? The silicone tape, you apply it over the incisions and you leave it on for 23 hours a day. So basically you're just gonna put it on and you're gonna leave it on for all day, just remove it for shower, okay? The silicone gel, you have to apply twice a day. So for people that just wanna put something in and don't wanna think about it, the tape is better. For people that don't want to have something adhere to their skin all day and all night long, then the gel is an option, okay? Both things are equally effective again, but you have to use it for at least 3 months to see a result, okay? If you use your silicone product for 2 weeks and it's like it's not doing anything, and you stop it, then you're not gonna see a result. Scar takes time. So scarring and products to help and to heal better, they're gonna take time as well. And sometimes people say, I've been applying the Silogen for a month and now my scar, it's getting darker. So scars don't heal like linear. They go like that, right? So they're gonna start to look thicker or darker. You have to continue the product. So then they kind of soften up, and with time, you'll see that the color and the softness will change. Sometimes you'll need more than 3 months. Sometimes you'll need a year of treatment. And that depends a lot on your healing and your skin type, okay? Dark color patients tend to heal thicker and darker. So if you have, and the best thing is if you have another scar, or it doesn't have to be a surgical scar, it can be a scar from an accident or when you were little. You have to see how you heal and see what things you need to do to try to prevent and be more aggressive with your scar treatment if you're a person that tends to heal badly. Another thing that a lot of people tell me is the 2 most common things that people have is traumatic lacerations, and they're like, oh look, I healed horribly, look at that. Well, traumatic lacerations tend to be traumatic. So the skin is not cut like a surgical incision, right? In surgery, I try to cut it and not traumatize the edges. I put the stitches to avoid tension on the closure. With trauma scars, it's the contrary, right? The trauma made the tissue maybe like like the edges are rough. The closure wasn't under tension, was on tension. So all those things make that scar look worse. It doesn't mean that you're gonna heal that way on a surgical scar all the time, okay? And the second one is my C-section healed so nicely, but my tummy tuck didn't. Well, think about it. The C-section actually had negative tension. You had excess skin that with the pregnancy was there. So that incision healed without any tension because you had loose skin when you delivered the baby. So that skin is like, it's the perfect way of healing because it has no tension at all. With the tummy tuck, I'm doing the contrary. I'm excising skin, I'm pulling it, so I'm applying tension. So that's why it's so important to be bent over and so important to start the scar treatment. Because even though you had a C-section that healed nicely, doesn't mean that your tummy tuck is going to heal the same way because the circumstances are different, okay? So each surgery or each scar has its own circumstances, and understanding what makes that scar worse or what can make that scar thicker or darker is so important. And the other thing that is extremely important is avoiding sun exposure, okay? So a lot of the scar products have SPF on it. And if your scar, especially like arm lift, are in areas that are exposed to the sun, you should consider adding sunblock or SPF to those scar treatments. Or if you wish to just buy the product that is without sunblock, then you have to apply the scar treatment and on top of it, apply SPF. Okay, why? While the skin is healing, while those scars are healing, those cells, they're metabolizing faster than the rest of the cells in your body. So they absorb more light, they need more energy. So they absorb more light, so they get darker, okay? So that's why we need to protect the scars for up to a year. If you have incisions in the face, like a rhinoplasty, facelift, that's extremely important, which you need to be covering yourself and applying sunblock to the scars to avoid them getting darker, okay? I'll take some questions now.
Okay, this is in Spanish.
Okay.
So, can we have it in Spanish? Después de cuántos días del tummy tuck puede usar la faja stage 1. After how many days of the tummy tuck, we can use stage 1 garment.
So para la abdominoplastia yo pongo 2 drenajes saliendo por las esquinitas de la herida y es por eso que al principio vas a estar utilizando el binder, que es como un wrap con velcro, porque los drenajes van a estar puestos y en realidad no te puedes poner una faja. Así que vas a transicionar a la faja una vez los drenajes se remuevan. Los drenajes se remueven usualmente en 2 a 3 semanas. So now in English, when do you transition to a faja, your compression garment after your tummy tuck, is after the drains are removed. So for my tummy tucks, I place 2 drains. They come out on the corners of the incision. So those drains usually stay between 2 to 3 weeks, depending on how much they're draining. So at first, because the drains are going to be in, you can't really wear a faja, so you'll be wearing a binder, which is like a wraparound with a Velcro.
Okay, how long after a tummy tuck can I start massages, especially for scar tissue?
So
Massage.
massages at least 2 weeks after, okay? So I want the incision, again, no tension, not high tension on the incision for the first 2 weeks. After 2 weeks, then they can start massaging the areas of the incision and the abdomen.
Okay, why can I not sleep on my side after a tummy tuck?
So it has to do with tension and it has to do with the fluid and swelling. When you sleep on your side, that's going to be on the dependent position, so you're going to get more swelling and more fluid buildup in one side or the other. And also, I did repair in the center of your abdomen, right? I repaired the muscles there. So if you're twisting your body, you're creating tension in the repair in the center, and that's going to pull on those sutures. So that's why I want you to be sleeping what we call beach chair position, so you don't have to be like all the way sitting up, but your hips should be flexed a little bit.
Okay, this question is for a future patient. She will be here in 1 week for her BBL.
That's
and
awesome.
She asks, what's a lipo burn on the skin?
Yes, that's a very good question. So a lipo burn can be caused by different things, but it's basically the blood supply to the skin, it's been interrupted, it's been affected. So what are you going to see? It looks similar to a bruise, but it's darker. So it's closer to dark purple. And you can see a little bit of redness around it, okay? That is why we do our virtual follow-up post-op day 1. One of the main things is to examine your skin and make sure there are no areas of concern. So usually it can be caused with a lipo, or it can sometimes, if you do body type or energy devices, can burn the skin. It's just the blood supply to the skin, it's been compromised. The other thing that can cause or worsen a lipo burn, it's a faja that it's too tight too soon. So the skin with liposuction, it's been traumatized, right? I'm putting a cannula and I'm taking the fat layer out, and the skin gets the blood supply from the fat layer. So by thinning that, the skin's already got a hit. So the way that the skin with the swelling and the compression, then the blood supply can be affected and you can develop those lipo burns. And that is one of the main reasons the garment that you're going to use for the first 7 to 10 days is the stage 1, which is a low compression garment. Sometimes patients are like, this faja feels too loose, I'm going to lose my shape. Don't worry about it. The first few days are to protect your skin, your massages, and your hydration. After those first 7 to 10 days, once the skin starts to heal, then we can switch to the stage 2, which is the high compression, and we focus on shape.
What type of clothing do you recommend to use during recovery from tummy tuck and breast lift? Actually, I'm on a makeover.
Yes, something comfortable, okay? One of the things that is most important is the waist area. Sometimes people start to put either too tight of underwear or too tight pants, and that because you're still swollen, if you get a tight underwear or pants, can create a crease, especially in your waist area. So that's why it's better for those first few weeks to wear loose clothes without tight underwear.
Okay, This is important because it says, "Hello, Dr. Vidal. I know Pure offers virtual consultation. However, I would like to do it in person. Is that okay?"
Yes, of course. So the first step is to fill the virtual consultation form online. That is going to give us some baseline information regarding your health condition, your weight, your height, your age, your past medical history, medications, and the pictures you submit to see if the procedure you're interested in is something that you're really a candidate for. Once we have that baseline information, then we can go ahead and schedule either a virtual or an in-person consultation, and the person that's going to be contacting you, which is one of the coordinators, can help you with that.
En español,
Sí.
sí puede hablar un poco sobre las cicatrices en los procedimientos de seno, cómo cuidarlo.
Sí, la cicatrización, especialmente en el levantamiento de seno, es bien importante porque la cicatriz va alrededor de la areola, hacia abajo y a través en el pliegue. Y para poder evitar que esas cicatrices se pongan gruesas, que se pongan hipertróficas, oscuras, es sumamente importante. Una es la tensión. So, yo te voy a pedir que los brazos no los levantes por encima de los hombros, ¿ok? Los codos pegaditos a tu cuerpo lo más posible. Está bien, te puedes lavar la cara, este movimiento está bien, pero no levantar los brazos de esta manera porque eso le pone más tensión a las cicatrices. Y a las 2 semanas vas a comenzar el tratamiento de cicatriz, que es un producto basado en silicona que viene de 2 formas. Viene en un gel o viene en un tape que te lo puedes poner encima de la herida. Cualquiera de los dos funciona súper bien. La diferencia es básicamente lo que tú te sientas más cómodo utilizando.
What to do if scars on tummy tucks start to bleed with compression and 2 weeks post-op?
If they start to bleed, I mean, the first thing is call us, right? If you are experiencing bleeding 2 weeks after surgery, we need to see you. We need to talk to you, and we need to see what's going on. It's not normal. It might be just a little bit fluid. Sometimes that happens. Sometimes it's a suture that's spitting up. Doesn't need to be, that it's dangerous. It might not be, but we need to check. We need to see what's going on. Because usually by 2 weeks, everything should be healed enough that you can start scar treatment. Okay, you guys, hopefully this is helpful for all the patients, because even if you're getting liposuction or BBL, facelift, rhinoplasty, breast procedures, anything, we're dealing with surgical scars. So hope this few tips on how to prevent ugly scarring or thickened scars help out, and send me some new topics to discuss next week. I'll see you guys next Tuesday with Tuesday Tips, and have an amazing Thanksgiving. Hope everyone spends a beautiful time with their families, and I'll like to see some pictures, so send me some pictures to see you guys preparing your turkey and your meals, and I'll be snuggling with my little baby and eating some turkey too. Bye bye.